The Valley Community Services Board purchases property for a crisis center and should break ground this year. Chris Graham and Crystal Graham here for Augusta Free Press. Crystal, this is a story you've been reporting on for a good while now. The VCSB has purchased property for its crisis center, plans to break ground. What are the details here?
Well, you may recall the Valley Community Services Board was looking at locating a crisis center near the outpatient pavilion at Augusta Health. The community, if you think about where that is, really, there are some apartments and townhouses and residential living areas nearby, school bus stops kind of on that road. And several community members spoke up and said that they were unsure if that was the best location. They agreed that there was a need, but it was the kind of not in my backyard mentality. They were concerned about safety. They also raised issue with potentially housing values going down, things of that nature. There was so much public outcry after that. The Valley Community Services Board decided to go back to the drawing board. It was a situation where they needed some um, the board of supervisors to basically make some exceptions to some rules that were in place there. They needed the building to be able to be higher, to be larger than that parcel of land allowed. So with the community making such a big deal about it, they assumed that that would not go through. So they went ahead and withdrew the application for those considerations with the Board of Supervisors and Board of Zoning. So that happened earlier this year, and Valley Community Services went back to the drawing board. I was actually chatting with Kimberly McClanahan, the executive director of Valley Community Services Board, about Medicaid cuts. And while we were chatting about that, she did mention that they have actually purchased property. And in this case, it was a property where they did not need anything to go before the Board of Supervisors. It was already zoned the way that they needed it to be. And the property in this case is located kind of across the street from the hospital. If you think about Tinkling Spring Road that leads to the hospital, this is going to be across the street near some trucking areas on a road called Wilson Boulevard. So the property has been purchased, and at this point, what they're looking forward to is breaking ground potentially later this year, as you said, Chris.
The Virginia Department of Behavioral Health has committed about $10 million to this. It's got a $15 million price tag. The goal is to open by 2027, so that might be ambitious.
Mhm.
Talk about the need here. You had some numbers, of course. We know that you've worked in the suicide prevention field for a number of years. We have some startling numbers here locally in terms of the need for suicide prevention services in this region.
Yeah, well, first, the funding gap, the $5 million, some of that will come from Valley Community Services Board. Their board members have pledged some money. They'll also be looking for localities to chip in where they can. But of course, they know money is tight for a lot of different reasons. But they are moving forward. They do feel like they have the funding secured to move forward with this. And they're also afraid that if they don't use this money, that they'll lose it, right? And so when you talk about the need, Chris, Augusta County is a rural area. And like most rural areas, unfortunately, there aren't a lot of options for people that there are in bigger cities. Valley Community Services Board is working to implement a mobile crisis unit. Their biggest problem has been staffing, hiring. Um, that's a whole nother issue because the workforce related to mental health is graying out, so to speak, and it's been challenging to fill even open positions with the Community Services Board. But the biggest issue, and like you said, I have worked in suicide prevention for more than a decade, is that in this area, the suicide rate is nearly double that of the state and national when you look at those statistics. And it could be again that there in rural areas, the areas there typically isn't as many options for treatment, and so this crisis center, once it's built, will have two components to it, Chris. It'll have a crisis receiving center, which is where someone can be taken, or they can take themselves. It's basically like a 24-hour observation unit. Typically now that has to be done in an emergency room, or Valley Community Services Board is working to set up something where they can actually be dropped off at their Stanton facility, and they have people there. But they're generally met by someone who has living experience, a peer, who's trained in intervention. And so it kind of just gives them a place. Normally, a crisis situation only lasts for a short period of time, and then you can be get back to your normal life, so to speak, but with supports in place, whether that's going to counseling, being connected with a family member or someone who knows of your struggles and can help you, those kinds of issues. And then the second component, and this is a longer term one. So if you're not ready to go home after that, initial period, then you would look at something like generally like a 3 to 4 day stay, though the facility will allow people to stay, I think, for up to 15 days. And that's where you work a little bit more one-on-one with people who are trained in this, and whether it's doctors or therapists or whatever, they try to get your medication straight. They try to get you a plan, so that when you go home, hopefully that crisis doesn't arise again. You have the supports that you need.
I mean, this is a story that, if for whatever reason, is not getting a lot of attention in the local media, but obviously a very important story. Crystal, you've been on top of it from day one, and we will continue to await further updates. But on schedule, it looks like for perhaps a 2027 opening. So, big news for our area here. Yeah, for those out there who have any issues in this area, Crystal, what can people do? I mean, if you have behavioral health issues, if certainly any thoughts of suicide, what are the recommendations in the here and now?
Well, of course, Valley Community Services Board does offer an array of services, and one of their agreements with the state is same day behavioral health response. So, certainly, if it's not a crisis situation, or if it is, if you're coming, that kind of thing, they can help. That's a good place to start. And Community Services Board, whatever community that you in, are always a good place to start if it's not an immediate crisis, because they can even give you guidance as to, what your options are in the community. And you can always use that 988 lifeline as well. The 988 lifeline is staffed 24 hours a day. They are people who are trained, and they are people who can get you the help that you need. And you don't have to be in crisis to call 988. That's another thing too. There's also something with Mental Health America, and the Virginia chapter has something called a warm line. And again, if you aren't in crisis, you can actually reach out to that warm line, and get some support as well.
All great resources. And Crystal, of course, we have a mental health page on our Augusta Free Press website. And so if you need anything, you can certainly go there. It's a one-stop shop for that. Well, thank you, Crystal, for your time and insight on this. And we hope that if anyone out there is in need, please do take advantage of the resources that are available.